Hello and welcome to One Fertility. My name is Maya and I'm a registered nurse. I will be walking you through this tutorial. Make sure to have your audio on as some information will only be presented verbally. The purpose of this tutorial is to help you understand the tests that you were ordered and to help you understand when and where to do your testing. Some of the testing that we will review may not apply to you. At this stage, you should have completed your medical history, attended a visit with your physician, discussed the testing that was ordered for you, and received an email with requisitions as well as information sheets. Your email should look something like this. It can be a little intimidating seeing all those attachments, but hopefully after reviewing this tutorial, it will be clear to you what you need to do. I'm going to bring your attention to the new patient package. The new patient package introduces to you how our clinic functions. It gives you some suggestions of what you can do to improve your fertility. It offers some questions you can ask your physicians, as well as provides other resources where you can get more information about fertility. The next document I'm going to bring to your attention is this one titled Information for New Patients. This document outlines what testing was ordered as well as where and when to do the testing. This material will also be covered in this tutorial. However, if you're wondering where to start with your documents, that particular document is a good place to start. The rest of the documents are either requisitions or information sheets. We wanted to go over the process of receiving care at One Fertility. We already talked about step number 1, which is visiting with your doctor and getting testing or investigations ordered. Then step number 2 would be to complete the testing or investigations. Step number 3 would be to meet with your doctor to go over the results and develop a treatment plan. At times, some of your testing may lead to further testing, and your doctor may order more testing or ask you to do something else prior to treatment start. We then get into our treatment start. Generally, people will try the same treatment several times if the first attempt was not successful. If you have not had success in 3 to 6 months, if you would like to switch your treatment plan, or if you have tried the same treatment plan several times without success, then it would be a good time to book a follow-up with your physician to regroup and talk about different treatment options. If your treatment was successful, we can follow your pregnancy for the first trimester. After that, you would graduate and you would receive care either from your family doctor, you can self-refer to a midwife, or we can make a referral for you to be followed by an obstetrician. Blood work testing. Our clinic has a lab, but we can only process a few blood tests that are required during treatment. Any requisition that you received that looks like this needs to be taken for testing at an outside lab, for example, Life Labs or Dynacare Labs. When you go to an outside lab, the results come directly to us. You can also check off the copy to clinician/practitioner box and provide your family doctor's information here if you would like your family doctor to also get a copy of the results. Please print these requisitions and make sure to label them with your name and health card number in the area where it's requested. Also, please check the additional clinical information box to see if there is any special instructions regarding the blood work. For example, if this box says fasting, it means that you need to fast, which means not to eat or drink for 10 to 12 hours prior to going for that particular test. If your requisition says to do the blood work on day 2 or 3 or 4 of your cycle, it means that the blood work needs to be done during that time period. Please note that it is illegal to add any tests on the requisitions that your doctor did not order for you. Infectious disease screening through blood work. All patients receiving care at One Fertility are asked to do annual infectious disease screening. You should have received these requisitions in your email, and the document is titled ID Screens. You do not need to be fasting for this test. The document is a 3-page document, and we ask that you put your name and OHIP number on all 3 pages prior to going to your outside lab. This testing requires multiple tubes of blood to be collected, ranging from 4 to 10. Having expired or incomplete infectious disease screening will delay treatment start. We recommend that you go get this blood work done as soon as you can. AMH is an ovarian reserve blood test. This test is not covered by OHIP. It tells us about your egg quantity. It is usually done at one fertility on the day of your sonohysterogram, also referred to as the sono test. It may be done at an outside lab. When you call to book your sono, please mention that you will also be doing your AMH if it was ordered for you. We will discuss the sono a little bit further on in this tutorial. Up to this point, we reviewed routine blood testing. Here are some additional blood testing that can be done at an outside lab if your doctor ordered any of these tests for you. For example, PCOS blood work. This blood work should be done fasting and sometimes can take up to 2 hours. Your doctor may have ordered for you to have a sugar drink to do at the time of your blood test. RPL is recurrent pregnancy loss blood work. This blood work should also be done fasting, and some of the ordered tests may not be covered by OHIP. So please, when you go to your lab, ask if there are any fees and what they are so that you're aware if there are any fees. Karyotype is a test that can take a very long time. All of these blood works we recommend that you do as soon as you can. There may be additional testing that your doctor may order for you based on your particular history. Urine test infectious disease screening requisition looks like this. It is labeled as urine rec as one of the files in your email. This test is to be done at an outside lab and should be done as soon as possible. You can do this test at the same time as you go to get your blood work done. The reason that it is important to do this test as soon as possible is because we need the results of this testing back prior to your sono test if the sono test was ordered for you. Prior to going to the lab, please make sure to complete your name and health card or OHIP number on the paper. Also, if you would like the report to be sent to your family doctor, check off the Copy to Clinician Practitioner box and write your family doctor's information in the box provided. The sample of urine should be produced at the lab facility and should include the first amount of urine that you pass. Pelvic ultrasound and sonohysterogram, also referred to as sono. These tests are done at one fertility. Please call on day 1 of your period to book these tests. Generally, they are done between cycle day 6 and 12, but can be done at different times in your cycle. If you call the clinic and you don't reach reception, please leave a voicemail and they will call you back. When booking these tests, also mention if an AMH test was ordered for you, as it can be done at the same time. Also, make sure that you book a results visit with your physician. If you do not get periods, your doctor would have given you a plan of when you should do these tests. The plan may include taking a medication to bring on a period or doing the test random, which means any cycle day. Make sure you have done your urine test at least 1 week, if not earlier, prior to this test. No unprotected intercourse for 2 weeks prior to testing. You need a full bladder at this appointment, which generally means finishing 3 glasses of water 1 hour before. We generally advise taking pain medication 30 to 60 minutes prior to the test. Anti-inflammatories like ibuprofen or Advil generally work best. but some people may prefer medications such as acetaminophen or Tylenol. Please also read the information sheet that was provided in your email that discusses this testing. When you arrive for your pelvic ultrasound and sono test, the test will begin with an abdominal ultrasound. Next, you will be asked to empty your bladder and a transvaginal ultrasound will be performed. After that, a small straw-like catheter will be passed through the cervix into the uterus. Saline or salt water will be injected into the uterus and an ultrasound will be able to visualize the inside of the uterus. We will also flush the fallopian tubes to check for any blockages. The test can result in some cramping as the uterus may contract and cramp to try to get rid of the fluid that was injected. This is very normal. You may experience some spotting or soreness after this test, and this can last for several days. Please notify the clinic if you have worsening pain as the day goes on, foul discharge, fever, or period-like bleeding. Sperm function test or SFT. This testing is done at One Fertility. Please call the clinic to book your appointment. Read the information sheet that was provided to you in your email. The document is labeled SFT. Please bring your requisition to your appointment. There's a fee associated with this test and the amount will be indicated on your information sheet. The test requires 2 to 7 days of abstinence for most accurate results. Collecting the sample can take place at home or at the clinic, although producing at home is preferred as long as the sample can be delivered to the clinic within an hour of production. If producing the sample at home, please make sure to pick up a collection cup in advance. Bring the sample to the clinic to your scheduled appointment at body temperature and make sure that we have it delivered to the clinic within an hour of production. Also, don't forget to bring your health card. This particular test looks at things such as sperm count, movement, viability, amount of normal sperm, among other things. Additional requirements. Based on your specific history and your treatment plan, these are some examples of some additional requirements that might be necessary prior to treatment start. For example, counseling, IVF teaching, referral to other specialists, or us receiving copies of your previous testing. Here are some examples of medications that might be ordered for you during your treatment. It's a good idea to check with your insurance to see if you have coverage for these medications, as fertility medications can be costly. At your result visit, the doctor will develop a treatment plan for you, as well as the duration of that plan, and then you will be sent information about your treatment plan by email. You may be also asked to sign consents through DocuSign prior to starting your treatment. This slide focuses specifically on receiving care at One Fertility during the COVID-19 pandemic. We have implemented a lot of safety measures during this time to keep our patients and staff safe. You will notice when you arrive at the clinic that the door is locked. There's a phone number on the door that you need to call to get screened. One of our screeners will ask you questions. If you screen negative, you will be asked to enter the building. When you enter the building, you will be asked to sanitize your hands. You will be provided with a surgical mask, which you need to wear while you're at the clinic. We will take your temperature, and you may also be asked to wear a face shield. You will notice markings on the floor which indicate to you the direction of which you need to follow while walking through the clinic. You will exit through a different door at the back of the clinic. Prior to starting treatment, we will ask you to complete a COVID-19 waiver. Your doctor will give you specific instructions of what you need to do to get started with treatment. Please note that at times we do need to delay treatment if our patient volumes are high. However, we will try to get you into treatment as soon as we possibly can do so safely. If you were ordered injectable medications, Those can be picked up at our inside pharmacy at your first appointment. If you were ordered oral medications, your doctor will help you arrange the pickup of those medications prior to treatment start. Part of your treatment may involve using ovulation prediction kits. Please let your doctor know if these have not worked for you in the past. Thank you for reviewing this tutorial with me. I hope that you find it helpful, and I wish you all the best.